I'm Geoff Omiatek. I'm the director of physical therapy and sports medicine at Orthopedic One. We were introduced to the Neubie back in 2018 by a mutual friend, and we had the privilege of having you come on site. And actually, you were in clinic with me for a couple of days, and it was really good to starting to see how it would work with our patients, especially my patient population that's very sports medicine minded. So staff bought in because they saw the results. Patients bought in because they really saw the results as well. I started seeing my ACLs do better on their isokinetic tests. I started seeing the individuals that I was working with and utilizing the Neubie on doing very well. Their isokinetic scores were, 10 to 15% deficits when historically maybe they were 20 to 25 at that time frame. So kind of general kind of successes there. More specifically, I had a professional CrossFit individual that couldn't do basically leg extension. We initiated this early on after a quad tendon repair. And within about 3 weeks, he couldn't do a full terminal knee extension. But then 3 or 4 weeks later, he's pistol squatting with it. And that was pretty significant. The motor plan was there. He just couldn't overcome the inhibition, and it was painful. We didn't change his tendon quality. We just allowed him to, overcome some of the neuromuscular inhibition, and that was a significant success story. And he's back to full capacity, full training. Other individuals we've seen, some people with some significant complex regional pain syndrome, RSD-like symptoms, and really utilizing your help, but also following up with your team. Your team is so gracious. When we call in with a question or email in with a question, they're providing us, immediate feedback on how to do things differently. Playing with some of the resonance frequencies, really allowing that patient to have some, successes in clinic that do have significant carryover. Most recently, I was treating a professional athletic trainer with a pro team, and he had significant chronic pain in terms of patellofemoral, had injections, had treatment, was treating himself. The only thing I did differently was apply the Neubie, and we looked at a couple different things. 1 or 2 sessions later, he was having 50-60% reduction of symptoms and was actually able to train. He'd done everything he needed to do. He's a very competent professional, but we just were able to add one variable in, and he had significant carryover. So I think those are just a handful of success stories. And you actually were nice enough to come up and do a co-treatment with me on him, and he's doing very well. And I think it's helpful to continue to collaborate because you guys are doing it differently at Austin in your clinic, and we can continue to learn from you.